Welcome to the El Paso Eldercare channel. I'm Stephanie Townsend Ayala, your video host and an El Paso elder law attorney. I'm joined today by Adrian Rodriguez, administrator of Crossroads in-home care, providing health care to New Mexicans and Southern New Mexicans and Las Cruces for many years. Thank you so much for joining us today. And I'm hoping that you can help us clear up some confusion. A lot of my clients don't know the difference between home health care and home care. And so I think it's really important that we kind of explain there's a big difference between the two.
Right. I get a lot of phone calls regarding people asking for services, saying they need a little bit of medication help. They need a nurse to come do this, a nurse to come do that, a therapist in many occasions. And what I notice is there seems to be a little bit of confusion of people who don't understand the difference between home health care and regular home care. Okay. Fortunately, my background is in home health, so I know it very well, which aids to my ability to help my patients and my clients succeed with their home health in my home care practice. So, but the home health just generally is where nurses, physical therapists, occupational therapists operate under a physician's order to provide clinical health care.
So home health involves actual skilled nursing care.
That's correct.
And they'll come into the home maybe a couple of times a week and take vital signs and watch over administration of medications. Is that one of the services?
That is definitely something they'll do. Working in conjunction with the physician orders, they can come in, depending on the severity of the case, they can come in frequently, not so frequently, but just to make sure that the health care of the patient is progressing, okay, that they're meeting their goals by the end of their cert period, that a wound is healing, that they're educated and understanding the medication they're taking a little bit better, that their range of motion post-surgery is returning back to normal. So they're going to focus on clinical stuff. They can work on anything from wound care to the physical therapy, getting up, walking around, strength training.
So a lot of these people have had strokes or broken bones or decubitus ulcers, and so you're trying to, there has to be some sort of a nursing overview and oversight.
Correct. Now, during that time when someone is, let's say, laid up because they've had a surgery, they've had a surgery on their heart. I don't know about you, but if someone puts an incision right around here, it's going to be really hard for me to lift my arm up and get into the shower and go cook myself a meal, take care of the house, clean the house and vacuum. So that's why I opened an agency called Crossroads in Home Care. What we do in home care is the non-clinical aspect of home care.
So talk about what some of the non-clinical aspects would be.
Sure. We could do everything from home care, which is cooking, cleaning, taking care of things around the house, going to the grocery store, picking up the groceries, bringing them back, putting them all away, to personal care, assistance with bathing, medication reminders. Now, most home care agencies can't actually administer the medication unless they have a certified med-certified attendant in the house, okay? But they can remind them to take their medications frequently, which is all going to aid in the home health agency or the doctor's plans to get their patient better. So where we call them clients, the physicians and clinicians call them patients. So our clients are on the right track to getting better and healing and feeling better.
And I can see where there's a perception, and I'm not sure it's so true, but perhaps it is, that if you're in a nursing home, that everybody's going to do everything for you. And it sounds more of what you provide is allowing somebody to prompt. You're not just doing the actual thing, you're prompting them, and that gives them a chance to have more independence.
You're very right. A lot of people, when like say a family member is calling me up, a son or daughter, and they want to get these services for their parents, because the parents are elderly, they need a little bit extra help around the house. The first thing that our senior is going to think is that, well, I can do all this. Why do I need the help? It's not necessarily that we want to put anyone and make them less dependent. In fact, we want to keep them independent in their home, not having to move to a long-term care facility. We want them to be able to stay in their home comfortably, safe, healthy, and happy, so that they don't have to move to a nursing home, and then all their activities of daily living are still met. They're still able to take a bath, they're still able to eat well, and have a clean house and enjoy their life.
Right. And as long as you can do anything on your own, you're, I guess, helping them to do it on their own as long as possible. And that is the fear, that once you leave the rehabilitation setting, because a lot of folks do spend a few weeks in rehab before they head home with the care services, and so there's a fear that you'll be at your peak when you go home, and then you're not going to do anything else when you get home.
Right. A lot of the time that we've noticed in home care is that when people come out of direct ed or rehab, is they go back to their normal routine that probably led them into the healthcare facility to begin with. Okay, they go back to eating unhealthy. They go back to walking around a house if they've had a fall, and walking in that very same area they had a fall and not change a thing. So there's a high risk of actually going back to a healthcare facility because you just went back to your normal routine.
Right.
Well, if you can come back with just a little bit of assistance, someone who's maybe walked through the house and said that's a fall hazard, we can get you moving, get a little bit more active, get you off the couch, maybe into the backyard. We can help with your gardening. We can sweep up there, and you can plant plants. Give our seniors an active lifestyle. Then there's a good chance that we could actually keep them home longer. As it sits right now, the way healthcare and the care medium to begin with, you can really stay in your home from cradle to grave. And I think that's a wonderful concept. You should never have to be able to be put somewhere or feel forced that you want to go somewhere. You can really stay home.
And it's such a difficult situation. A lot of folks can't do that without the assistance or even living in a home of a family member. Is that the situation?
Yeah. In many situations, we deal with the family member more so than we deal with the client, the senior themselves, because we have this new term, the sandwich generation. That's the family, the person who's taking care of their young ones at home, but also taking care of their parents at home. They're stuck right in the middle. That's a hard job. I'm a parent. I've taken care of elderly family members. It is not easy.
Being a parent is not for people who aren't brave.
Right. So what I realized before I opened Crossroads was that someone needs to be able to say there's a choice. You're not stuck. You're not stuck between a rock and a hard place. You always have an option to get a little bit of respite, to get out, go get your hair done, go do your yoga, go to a movie, do what you need to do. Someone is there to help you. So you can call an agency like mine where we can go in and just give you that little bit of a break so you can take care of yourself. Because if you're broken, you're not fixing anything.
That's right. And I want to talk a little bit more about some of those options when we come back in a moment. Again, you are watching the El Paso Eldercare channel with Adrian Rodriguez, Administrator of Crossroads In-Home Care, and we'll be right back. And we are back with the El Paso Eldercare channel. With us today, Adrian Rodriguez, Administrator of Crossroads In-Home Care, servicing Las Cruces in southern New Mexico. And Adrian, some of the options for care include, I don't have to hire you for a long period of time. I might just need you guys to come and give me a respite. Say, I'm taking care of my mom, and I really want to take the kids to Disneyland. Can you guys come in and take over for a week for us?
Sure. There's a lot of companies like mine that are private pay companies, okay?
Explain what that means.
What private pay means is that we're not working under Medicaid state guidelines, okay? My agency in particular, we still operate to those high standards, and I held my business practice and my employees to that high standard, but we have some freedom in that we don't have to stick to physician orders. We don't have to stick to the amounts that are being paid by the state Medicaid program.
There are a lot of rules that apply when you're under the Medicaid program, and how long you can come and that kind of thing.
Yeah, how many hours of service can you get? When can you get service? So you're beholden to what assessing nurse from the state wants you to have. With a private pay company like mine, there's no contracts, no binding agreements. You call me, you tell me, we set up services, tell me I need you for a week because I'm just coming out of the hospital and I just want to make sure I'm okay when I get back, and then after the week you feel better. Thanks, Adrian. It was great.
And that's it. Okay.
I love my caregiver.
And also you provide the respite services. Let's talk about that.
Yeah. A good question was asked is, what if, I want to go out of town? I'm in the sandwich generation. I have my kids. They've never been to Disneyland. I have mom and dad at home, but mom and dad, they're just not up for the travel. No. That's a, 10-hour drive from here? So
long
they don't
drive.
want to go. So what could you do? Well, you could hire a company like mine who can come in, give a free professional estimate, okay? We would tell you what we recommend for the house, up to 24-hour care, okay? Or up to 3 hours care, 3
whatever
hours being the minimum, yeah.
Okay.
So whatever the client needs at the time, and then make sure that everything's done in the house, that mom and dad are we cook for them, that we pick up around the house after them, that we make sure they get in and out of the shower okay to prevent falls, that we kept up with their medication while you're out of town. So it's really nice to have backup, to have a good guy in your corner to help you out when you really need that break. You need to get out of Dodge for a little while and go relax. And it's nice to know that there's always an option with a company like mine.
What are some of the questions that your clients come, some of the things that you really wish they understood before they came to you?
I would like for people to know that when they call, most of the agencies in town, even in El Paso and Las Cruces, most of them are actually private pay companies. Okay, everybody expects maybe their Medicare to pick it up and
or insurance coverage.
Right. I fight. I've gone to DC many of times.
Really?
I talk with Congress and State Senate, and I'm trying to get everyone to pick it up and maybe provide more of these services, because these services are needed.
Wow.
It's not a question whether they're needed or not. They are needed. Okay, and we would love for them to pick it up, but unfortunately, the amount that people want, the amount of hours, the amount of help, it's going to fall under a private pay company. So I want people to know that most of the time it's going to be a private pay issue.
So what are the rules changes that you would like to advocate for that would make it easier for the citizens, that like you said, talking to Congress and stuff?
There's a couple of programs that we're working on right now, working in conjunction with Congressman O'Rourke here in El Paso and several other Congressman Pierce in New Mexico. There are some things that we're working on in the pipeline, some House resolutions that even Congressman Pierce has signed on already that I'm still working on. Congressman O'Rourke, if he's watching, I need his help on this. And what it is, it's really to make sure that the spectrum of healthcare that we operate in is accessible to everybody. That we don't start shrinking the amount of agencies that we have. That we don't start making them work with their hands tied behind their back, so that everybody can get good quality home health care and home care services, and even hospice services.
Correct. And a lot of people are pretty upset about just the idea of having somebody come into their home.
That happens.
And how do you help people get over that? You guys are licensed, bonded.
Right.
You guys have folks who have to meet certain criminal background checks. How
We
can we
do 4
feel
layers,
safe?
filtration and background check.
4 layers?
Yeah, I mean, we check with the city, we check with the state, we check with the fingerprints on the national level, and then
You do national database?
right. We also make sure that even if it's not illegal to be rude, we still want to check on industry websites to say, okay, is this person red flagged for anything? Maybe they were rude, maybe they were didn't accused of stealing but didn't get caught stealing, something like that. So if there's red flag, we won't hire them. They have to meet a really strict interview process in order to be hired.
That's comforting to know. And what are some of the other problems people have in terms of understanding services?
Well, people sometimes do feel like we're going in there and they're calling us a babysitter, and that's not the case. We work at their discretion, and whatever they ask for, we're there to do. So in fact, it's almost like just having your own personal assistant. Everybody wants one of those, and now in their senior years, they can have that. That's actually very easy to have. You can have someone sit down with you and make sure that all the stamps are applied to the envelopes while you do your bills and pay, send out your bills. You can have someone go pick up your dry cleaning for you, or change your bedding for you, or answer your phone calls at your house because you're tired of the telemarketers calling.
So. You know what's so interesting to note is that some of the adult protective services calls that are made for people who might be self-neglecting or neglecting themselves are made by home care providers who are fired sometimes by the client who just doesn't want to accept that they need help.
Right.
And so I've gotten calls at time when somebody got fired, and so APS has to get called because there's no care there.
Right, and when they abandon themselves, there's not much we can do after that point. I'm not the type who's quick to call APS, but if it's a situation where someone's really in danger and we didn't report it, we can get in trouble ourselves. So I want seniors watching the show to understand that if that does happen, it's not because we're aggravated. I've never taken out any anger on anybody in my practice, but it's because we want to do what's right.
There's a law. This is a good time to talk about the law that applies to all citizens. We are required, if we have knowledge, we don't have to know for a fact that it's occurring, but if we have knowledge that an elderly or a disabled person is being abused or neglected or exploited, or even self-neglect, then we're required to make a report.
Right.
It's not an option.
It's not, and it's always in the best interest of our clients. Every single one of my clients has my personal cell phone number. There's very few agencies out there where you're going to get the administrator's personal cell phone number where they can call me anytime. Family members.
I'm sure that's unusual.
Yes. So it comes in handy knowing that if you're looking for an agency, whether it be in El Paso or in Las Cruces, those are some good things to ask. What's your accessibility? What if there's an emergency? How can I get a hold of someone to that company? Is it a large national chain where I'm going to be routed to New York? Press 1 for English, press 2 for Spanish. Or are you going to be able to call a director right then and there and get an answer?
Those are all good questions, all really good questions. So, I guess the upshot is be a good consumer, ask a lot of questions.
Right.
Any final thoughts, Adrian?
No, just thank you for having me. Please, when you're looking for an agency, shop around too. Look at the prices, see what you can afford. Our agencies like ours aren't in the business of putting people in the poorhouse. We want to give the most we can, but also we still have to run a business and pay the employees at the same time. So, but shop around, see what fits your budget, see who can do what you're asking for, and make a good informed decision.
Well, thank you so much. You've been watching the El Paso Eldercare channel with Adrian Rodriguez, administrator of Crossroads in-home care in Las Cruces. Thanks again, and we'll see you real soon.